What happens when a healthcare executive, celebrated for his achievements, becomes embroiled in the healthcare industry's most contentious practices? Well, meet Sir Andrew Witty, a man knighted for his accomplishments amidst leadership in corporations connected to claims of bribery, illegal marketing, contaminated drugs, collusion, and insider trading. Today, we'll take a closer look into the career of Witty during his time at GlaxoSmithKline and currently at UnitedHealth Group. If you're new here, welcome to Mimi Leaks. We examine some of the people and topics catching today's headlines. If you're returning, thanks for tuning in. Please don't forget to subscribe to the channel for more videos like this and hit the notification bell to stay informed. And stay tuned to uncover more in the story of Sir Andrew Witty. Born on August 22, 1964 in the United Kingdom, Andrew Witty attended the University of Nottingham, graduating with a degree in economics in 1985. Witty says of that time, quote, "It was an interesting and exciting period politically, musically, and socially. There was still a recession, but it was at the beginning of the 80s boom, deregulation, and all that stuff." Witty's career began in 1985 as a management trainee at Glaxo Pharmaceuticals UK. He held positions including Director of Pharmacy and Distribution and President of Pharmaceuticals Europe. By 2008, Witty had become the CEO of the company, one of the world's leading pharmaceuticals. In 2021, Witty became CEO of UnitedHealth Group, and by 2023, he was the highest paid CEO among U.S. health insurers. That year, his total compensation was $23.5 million, an amount that not only significantly surpassed his peers' earnings, but also stood at 352 times the median salary of a UnitedHealth employee. Under Witty's leadership, multiple scandals have surrounded both GlaxoSmithKline and UnitedHealth Group. During his 9-year tenure as CEO, Witty navigated a turbulent period for Glaxo, marked by numerous scandals and investigations. In 2010, the company paid a criminal fine and forfeiture totaling $150 million and a civil settlement of $600 million. The settlement was related to claims that Glaxo manufactured contaminated drugs at its Puerto Rico facility, then sold them. In 2012, Glaxo resolved a case following revelations from multiple whistleblowers, exposing the company's extensive marketing scheme aimed at promoting several of its top-selling drugs for off-label uses. It was the largest healthcare fraud settlement ever paid, totaling $3 billion. Then, in 2013, the company was met with accusations from 11 countries: Bahrain, Iraq, Jordan, Kuwait, Lebanon, Oman, Poland, Qatar, Romania, Syria, and United Arab Emirates, of bribing doctors in order to increase prescriptions of Glaxo medications. Also in 2013, Glaxo was found guilty of bribing doctors and hospitals in China to boost drug sales. The scandal involved a network of travel agencies funneling money for bribes, and a sex tape of a GSK, Glaxo, executive sent to senior staff. Glaxo was fined $490 million, and several executives received suspended prison sentences. In 2015, the company received a fine of $9 million, imposed by India's Competition Commission for allegedly colluding with Sanofi India regarding bids to supply a meningitis vaccine to the government for Hajj pilgrims. And in 2016, Glaxo was fined roughly $54.5 million by Britain's Competition and Markets Authority for allegedly paying generic drug makers to illegally launch the delay of cheaper versions of Glaxo's Seroxat, an antidepressant. If that list wasn't comprehensive enough, UnitedHealth has also encountered allegations and findings of corporate misconduct since Witty joined the company. In February 2024, UnitedHealth Group, under Witty's leadership, faced a cyber attack on the company's subsidiary, Change Healthcare, leading to widespread criticism and a Senate hearing. In a letter to Witty dated April 25, 2024, the attorneys general of 22 states criticized the wholly inadequate response to the cyber attack, stating, quote, "You must do more than you are currently to avoid imposing further harm to our state's healthcare infrastructure and the patients who rely upon it." The AGs called for more transparency, immediate action to protect healthcare infrastructure, and more support of the providers and patients directly affected by the cyber attack. In May 2024, UnitedHealth and 3 individual defendants, Andrew Witty, Executive Chairman of the Board Stephen Hemsley, and UnitedHealthcare CEO Brian Thompson, faced a class action lawsuit alleging insider trading and fraud. As covered last week on the channel, the lawsuit claims executives sold shares based on non-public information about a federal antitrust investigation, costing shareholders millions. An October 24 report released by the United States Senate Permanent Subcommittee on Investigations, or PSI, revealed that UnitedHealthcare's denial rate for pre-authorizations has doubled in 2 years, from 10.9% to 22%, linked to the implementation of automation and predictive technologies. Automation is the basis of yet another ongoing lawsuit, in which the estates of 2 now deceased individuals claim that faulty AI denied coverage for their loved ones, leading to significant financial and medical hardships. While on the subject of nursing homes, in 2022 alone, their denial rate for such care was 9 times higher than in the years prior to Witty's tenure at UnitedHealth Group, at 12.6%. Finally, in December 2024, UnitedHealthcare CEO Brian Thompson was slain outside of UnitedHealth's investor event. As tragic as the assassination was for the company's condolence message on Facebook was met with 77,000 laughing emojis before responses were disabled. Witty has stayed out of public eye, but in a message to staff following the death, he stated the following regarding public criticism. "We guard against the pressures that exist for unsafe and unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable." Perhaps it would be unfair to provide the scandals and controversies without highlighting some of his accomplishments, and in that regard, under Witty's leadership, Glaxo pledged to lower drug prices in low-income countries and created a patent pool to foster new drug development. Witty was knighted in 2012 for his services to the pharmaceutical industry and contributions to global health. From 2013 to 2015, he co-chaired the Commission for Defeating AIDS and Advancing Global Health. He served as chancellor of his alma mater, the University of Nottingham, from 2013 to 2017. And finally, in 2020, Witty co-led the World Health Organization's COVID-19 vaccine efforts, co-chaired a global collaboration to ensure equitable vaccine access, and advised the UK's government vaccine task force. Andrew Witty's life is a display of the complexities surrounding business leadership in the healthcare and pharmaceutical industries. While he may not be a household name, Sir Andrew Witty has certainly left an indelible mark on global healthcare. Thank you for joining us on this episode of Mimi Leaks. Don't forget to like and subscribe for more. See you next time.